Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Hello, I'm Dr. Merrill Hasnan. I'm a psychosomatic medicine specialist and a healthcare activist. As we all know, we have COVID-19 epidemic going on, and I have prepared this general public education video lecture to address some of the concerns related to the fear we are going through. So I'll try to explain how we can turn that fear into some productive and responsible behavior. This is going to be about a 30-minute video, and so let's get started. So as we all know, we are now in an epidemic for the new coronavirus, and the infection associated with it has been called COVID-19. And when I made this presentation earlier today from this reliable website, it reported that we currently have over 160,000 documented cases across the world. 146 countries and territories have been involved. So there are documented cases almost throughout the world. And over 6,000 individuals with COVID-19 have unfortunately died. So this is a reality, and we can't deny that this epidemic is happening. It is obviously scary. It's scary for every person in the world, and every community and every country is trying to deal the best it can with it. Now, when we are afraid or we are scared, we sometimes lose track of what we need to do. So with the current situation, I'm sure you must have seen videos on social media how people are in some situations are panicked about it. There are long queues on stores. People are worried about their safety. People are concerned that they may have to lock themselves in their houses for months, so they need to stock up. So in this presentation, I'm going to talk about that fear response that we go through and help you understand what that response is, and then relate that response to how we think and how we can do something productive about it. Now, we all know what fear is. We have experienced, most of us at least, would have experienced it in one way or another, and many times over the course of our lives. But while we have experienced it, and there is a certain feeling to the feeling of fear, but fear is unique for every person and for every situation as well. So it has three major components, there are three ways in which, three broad categories in which we can respond when we are afraid. Firstly, fear can make us get ready and tackle a situation. So if we see a snake, for example, and we are afraid of snakes and we know it's a poisonous snake, we get afraid, we run away, we try to find means to get rid of the snake or move it away from the snake. So that's the typical fear response, and it's also called the common fight and flight response. And that is the very basic response that we get, and in most cases it helps us to deal with the situation. But sometimes when fear escalates beyond limits, we tend to get what can be called a feeling of terror or a feeling of panic. And when we get through the state of panic, if the fear escalates to the point that we are in a state of panic, we tend to get disorganized. And a simple example would be that if someone who doesn't know how to swim and is in a boat and he or she is not wearing a safety jacket, and the boat turns over and the person is now in the water and doesn't know what to do. That's the panic state that the person will be. He'll just thrash in the water and not know what to do. And that's basically what panic does. Panic makes us just become, just do things in a very impulsive and in a way, and in a very herd-like manner. And the third major element that in which we can respond when we are going through a state of fear is that we can bury our heads in the sand. And what it means, basically, we can just ignore it completely, and or we can go into a state of freeze. We just freeze. We don't know what to do. Or we can go into a state of denial. So these are some common ways that we deal with, and we want to understand how we are dealing with it. But this is the emotional response, or the very basic emotional and autonomic nervous system response. Now that we are a well-evolved intellectual species, our fear is not as simple as we will see in other mammals, for example. So in this slide, I try to explain what we do when we go through a state of fear. It's not just an emotional state. For humans, it's a core survival mechanism. So it's a simplified slide, and the point is I'll try to explain that how we integrate fear with our intellectual brain. So if we look at the brain, and I've mentioned three levels of brain here. So there is an emotional brain, and that's, many of you may have heard the word amygdala, or the limbic system of the brain. So that's the part of the brain that deals with the emotions, and fear is one of the emotions. So that's the part of the brain, and it's a bit lower than our top part of the brain. And then there is an intermediary part that connects our emotional or fear response to the highest and the most developed part of our brain. Mostly it will be our frontal lobe, or the prefrontal cortex, and that area of the brain. And that's our intellectual brain. So what we do when we are in a state, in a threatening situation, or in a situation that is making us afraid or anxious or nervous, what we do is that we use retrospection, which is basically, retrospection means our past. So our brain is a very interesting machine. So it stores information from the past, and that information that is stored is in the forms of memories, in forms of experiences, and in the forms of knowledge. So we use that past information or memories, we mix it with the current situation, and for the current situation, we learn, we appraise the situation, we worry about the situation, we ponder, we brainstorm, we plan, and then we project it into the future. And when we project it into the future, we use all those mechanisms to see where things may be 2 weeks, 4 weeks, a year or 2 years down the road. And when we do all that, there is a lot of speculation involved even in the process itself. There are a lot of biases involved as well. And those biases are our own personal biases. I'm not talking about the biases that we may get from the media or from information that we are trying to assimilate. It will be just the biases of our past experiences, our own personality makeup, our own lifestyle, our own resources, and all that. So we use the fear, we mix it with our intellectual brain, we use the past information, memories, and experiences, we brainstorm, and we plan for the future. This is how our mind works in the situations like COVID-19 and the fear associated with it. Now, when we do all that, when we mix our fear with our intellectual brain, there are certain psychological mechanisms that we may use, overuse, or underuse, or use appropriately or use inappropriately. And so few of them, and the major ones, they are the major ones, in this slide, they are noted in red color. And so one of the mechanisms that we may use is that we may go into a denial. And that will be the example of burying our head in the sand. So we don't want to deny a problem if it is really there. And it's sometimes hard to imagine that somebody who knows that so much of COVID-19 infections and deaths have happened over the last several weeks will still deny it. But believe me, people do go into states of denial. And a simple example would be when someone who has a heart attack and 2 weeks later starts smoking again, because there's a denial about how the cigarettes may harm him or his heart. So that denial is we don't want to let denial take us, because if for those of us who are going to use denial as one of the mechanisms to deal with this situation, they will pose themselves and others at risk, and I'll explain that in subsequent slides. Now, we want to be rational in this current situation, but we don't want to rationalize risky behavior. And the difference between these two is that to be rational, we simply try to do the best. We try to do the best in terms of whatever information we have and use it logically to come to a rational choice or a decision. Well, when we rationalize things, what we do is that we tend to put our decision before the information. So we already have made a decision, and now we are trying to gather information that will support that decision. We are not using the information to reach a decision. We are using a decision and then building information around it. And we don't want to do that either in any situation, and particularly in a situation like this we are dealing with. Now, we want to speak up, and speak up in terms of to express our thoughts about the situation, and to talk about what we want our public representatives to do, what we want to speak up what our employers should do. But we don't want to practice displacement. And displacement means when we start blaming others without taking any responsibility ourselves. So we have to work with others and not just blame them for all the faults. We don't want to intellectualize, and people like me who have an academic background, they are most vulnerable to do that. So what it means that they will just read and read and read and try to synthesize information, and so it's good for some people who are in the profession because they want to stay updated and all that. But for an average person, it's not healthy. It's just you're just going to end up spending a lot of time on trying to gather information that basically probably will not help you much. Do not regress. And regress, as the word says, it means that you move from a certain level below to that state that you were in. And when we regress, we tend to neglect ourselves. So when people are in a state of regression, they expect that somebody else will take care of them. They may not attend to their hygiene. They may not attend to their day-to-day commitments. So it's in a way similar to becoming amotivated. So we don't want to do that either. And we want to use our time and energy productively. And one way is to do it that we self-reflect and we turn our fear into something productive. And an example would be, say if someone smokes cigarettes, and now we know that somebody who already has smoke-related lung injury over the course of years of smoking is more vulnerable to COVID-19 related lung infections and pneumonia. This may be the time that you turn this fear into your commitment to giving up smoking. Or if you're obese and have diabetes, and you know that that's not healthy anyways. And now with the COVID infection, you're at a higher risk of its complications. Maybe you say, okay, now I'm going to take charge of my obesity, and I'm going to do something about it. Not saying you haven't tried it before. Many try, and it's a tough condition to deal with. But this is just an example. Now, in the previous slides, I tried to explain what is fear and how we process that fear with our intellectual brain, and then we use certain mechanisms, these are mostly semi-conscious, subconscious mechanisms that we use, and technically they are called defense mechanisms, and we come to some state. But in this slide, I'm going to, and in the subsequent few slides, I'm going to just talk about the COVID infection itself and tell you where we stand in terms of this fight. And to start off, I want to highlight that we are well positioned to fight this battle. And why are we well positioned? Because this is a new coronavirus, but it's not new in terms of its type. We have dealt with coronaviruses over the last few decades, and we know what they do. We know their structure to a great extent. Of course, every new coronavirus will have certain unique features, but overall we know about this virus, and we know about it pretty well. We know that it usually is in bats or in rats, and then from there it transmits to some other mammal. It can be a camel, it can be a certain type of cat, one example, or a cow. And then from there, it can transmit to humans. So we know some of its path, and so that enables us gives us a better position to fight it back. We are very familiar with the viruses anyways. An example would be the influenza virus. So we know we have dealt with, over the last many decades, we have dealt with influenza virus, hepatitis viruses, AIDS virus. So we know how they work. We know vaccines can be effective against them. We already have antiviral treatments that we can study in this particular situation, and hopefully one of them will work against it. Now, in this fight, virus has basically 3 or 4 important tools. And those tools are, first, it uses opportunity to transmit itself. So it basically is it's basically just a small molecule. It's a molecular structure. It can't think, obviously, but somehow it knows that if it moves from one host to the next, and it doesn't do that intentionally. It's just the environment that makes it happen. But that goes against us, because it means that it will move from one infected person to another healthy person. So that's one thing we need to be very, very mindful of. We know it can be lethal. We know it can make people sick. So those are the tools or the things that virus has, and now we have to look at what we can do about it. So because it can transmit, we have to fight it back by restricting the opportunities that it may have to transmit itself. So we have to contain it. And then we have to try to find medicine that is effective against it, or at least slows it down. And then we also can find a vaccine that works against it, and anybody who gets vaccinated will not, basically, the virus will become unable to infect that person. Now, we are already working on it. We, meaning the whole world, is working on it. USA, Canada, European countries, many countries in the world, they are working on it, and so we are well ahead in this game. in terms of the risk associated with COVID-19, it is certainly very concerning. It is fatal. It's lethal when someone develops COVID-19. But we have to keep in mind that of the 7 types that I've listed here, the highly fatal one will add a mortality or fatality rates of 30%, meaning 1 in 3 individuals who got MERS infection died. And SARS, which has been, based on the social media posts and how people are responding, I believe a lot of people think that this is another version of SARS. Now, SARS had a fatality rate of 10%, while COVID-19 has a fatality rate of about 1 to 2%. So it's not as highly fatal as SARS, but it is more easily, it seems to be transmitting more rapidly and more easily than SARS. So we have to balance that, and we have to make sure that we understand that what it means, that it's highly transmissible, and we need to work on making sure that it doesn't get transmitted. But luckily, if for the people, unfortunately for the people who get infected, it is not as lethal for them as SARS would have been, or certainly not as lethal as MERS would have been. So we want to identify the cases, we want to isolate those cases, we want to treat them, and we want to break the cycle of transmission. So how this whole process works whenever we deal with an epidemic or an outbreak, that's basically, I tried to summarize it in this slide. And this slide is very important to understand because this is what countries like USA and Canada and other developed countries are trying to do. We know that it has reached our communities, but what we are trying to do is that we are trying to keep the curve flat. So in this slide, you see a yellow curve and a red curve. The difference between these two curves is that the yellow curve is well manageable given our resource limit. So to give you an example, say we are in a city of 100,000 population, and there are, say, 30 beds that can be used for people who get sick with COVID-19. And there are so many medical staff that can look after those 30 beds. So if we at any given time stay within the 30 limit, we should handle it fine. We shouldn't have any problem handling with it because that will be well within our resources. But if it goes beyond our resources, then we have to get more resources from somewhere. We will tire ourselves. It will be a huge burden on our resources, meaning work individuals, healthcare professionals. They will burn out, and then we will end up in a cycle where we will be behind the curve. And I hope we don't get to that point, but any area that gets to that point, then they will have to triage their resources to stay ahead of the curve, or at least with the curve. Now, when we want this yellow curve instead of the red curve, again, it comes back to the point that we need to be well aware of the transmissibility of the virus. So if we make sure that we are not letting it move from infected person to a healthy person, we basically will stay the curve will stay flat and things will be easily manageable. So here is an example in this slide about what will happen if someone is responsible in dealing with certain behaviors versus someone who is not responsible. Again, say we have a city of 100,000 residents, and 4 residents in the city have COVID-19, but it has not shown to the point that those persons have sought help and have been formally diagnosed. So if they are, and so they basically don't think they have any problem. And of those 4 residents, if 2 individuals are sloppy in self-hygiene and they continue to socialize, they go out, they go to the bars, they go to eating places, McDonald's, like they intermingle with other people in the mall, and they socialize with their friends, and they are not careful about that, by the time they develop symptoms over the course of several days and they start realizing they are not healthy, they may have already transmitted the virus to tens of other individuals. And so they've already set up a cycle where because of that, their sloppy self-hygiene practices and their decision not to restrict their socialization, they may have already transmitted to those tens of other individuals, and those tens of other individuals may be several or few of them may be doing the same that these people used to do. So it will escalate that cycle of transmission. Versus if, say, 2 of the individuals who practice good self-hygiene and practice social distancing, as it is being called these days, over several days, only a few individuals might get exposed to the virus from them. And the likelihood is probably those will be the individuals that are in the same house. And so if by the time those 2 individuals who had practiced good self-hygiene and social distancing, they show symptoms and get diagnosed, for the health authorities, it will be easy to identify the people that had been in contact with this individual, because they will be mostly the people who live in the same house, and it will be easy to quarantine those individuals. But if the person had been socializing outside in public places and all that, it will be very difficult to then track down people that may have gotten accidentally exposed to this individual. So this is an example to put things in perspective. And we want, of course, all this will be determined by how our governments put policies on testing of individuals, on job attendance, travel, social distancing, and and policies around these. So where do we stand in terms of how can we use our fear and turn it into something productive? So there are 3 levels that we can use we can be productive. We can be productive at the personal level, we can be productive at the societal level, and we can be productive at the policy level. So at personal level, we need to follow personal hygiene guidelines thoroughly. And those guidelines are easily available on Health Canada, CDC, other websites. Basically, they involve thoroughly washing your hands, not using sanitizers. If we have symptoms, staying inside. If we have any coughing or sneezing, making sure that we cover we cover when we sneeze or we cough. So they're basic hygiene guidelines, and we want to practice them thoroughly. We want to keep our countertops clean as well. Secondly, we want to stop unnecessary socialization, and those will include socializing with family members who don't live in the same house, socializing with friends, and I can understand that it can be particularly difficult for people who are used to socialization to stay inside the house, not socialize with their friends. But luckily, we have social media. We can socialize on social media. And similarly, if there's no reason to go to the store, why do you want to go to the store? Why do you want to take the risk of being exposed to someone else? Or why do you want to take the risk of exposing someone else, God forbid, if you have something going on? Similarly, if there's no need, you shouldn't be traveling. Thirdly, we want to be mindful of our financial resources. Now, this is very worrisome that because of the COVID-19 outbreak, many workplaces that are not mandatory, that are not essential, they are closing down. They are asking their employees to take a leave of absence. Few of them are going to pay them while they are gone, but many are not going to pay them. And when we are at home, we may end up using our financial resources out of proportion. So we want to be mindful about our financial resources. At a societal level, we want to promote awareness and we want to promote responsible behavior and attitude. Similarly, we want to be mindful of what we read and what we post and what we share. There's a lot of misinformation going on. Now, I do use social media, mostly Facebook, and I see plenty of misinformation. And some of that misinformation is promoting fear. We don't want to do that either. So we want to be responsible and careful, and we don't want to promote negativity and undue criticism. Everybody, every discipline, every department, everybody is trying their best to tackle this situation. But if we have constructive input, we can try to offer that at the policy level. We certainly want to push for efficient and timely implementation of evidence-based policies. We don't want to the bureaucratic processes to slow these things down. So we already probably, from my perspective, I think we should have taken more dramatic acts a few weeks ago, and U.S. should have taken a little bit more dramatic acts a few weeks ago as well. But I think there has to be a certain amount of political will for that, and the public willingness to in that direction as well. So we want to promote those policies. We want to push for financial relief policies as well. And some governments are doing it because they realize this is going to be a hard time for many people. Some corporations are doing it. I hope that some of the corporations who are going to benefit financially from this COVID-19 outbreak, they are willing to contribute towards the communities, so that the communities can find some relief. And ultimately, all three economic pillars, the consumer, the corporations, and the government that regulates and brings the policies, we are all tied up. So at this time, the consumers are going to be likely to get into some financial difficulties. I hope policies make it easy for the consumers, because once consumers have money, of course, government will take some of it back in the form of taxes, and corporations will make it back by selling their stuff to us. So now I think this is the last slide. So I want to end this with a very clear, realistic, and positive note. So please remember, these hardships are always a test. They are a test of our faith, our resolve, and our integrity. We have dealt with such times in the past. In fact, we have dealt with much worse times than this. And we always came out as winners, as as human beings, as nations, as different countries did. So we are very capable to deal with this situation. We are a resilient species and we are a caring society. So we don't want to, we want to keep both the individual and the society in perspective. This hardship will pass, and hopefully it will pass soon. And thank you very much for watching this video. If you like the video, please share it, and thank you very much. Bye.